qualified for 25 years. This is our famous pesticide spray. Sofía! ¡Oh, papi! ¡Se los dientes! Tres veces.
Hello, Miss Rosa?
Hello.
Hi, my name's Erica.
I'm Jenna.
We're from the Visiting Home Nurses Association, so we're just here to see you because you called. How's it going? Wait, first, before we get started, can I have you verify your name and your date of birth?
Rosa Rodriguez, May 1st, 1965.
Perfect. And so what brought us here today? Can you tell me what's wrong?
Mom, I'm bad.
Hi. Okay.
Oh, hi.
How are
I do
you
not
guys?
want that. I'm not hungry.
Okay, I'll just put it on the table there for you.
Hold my hand, Chiquita.
Hi. We're from the Visiting Nurses Association.
Oh, hi.
Yeah, we're just stopping in to check on Rosa because we heard things weren't going so well. So can we get a little background first? What do you do?
I work at a farm and I spray pesticides on plants every day, all day long.
Okay. And how long have you been doing that for?
A long time.
All right.
What kind of symptoms have you been having?
My chest just hurts. It's pounding and pounding. And I'm so weak and tired.
Okay.
I'm cold. I'm freezing cold. Get me a blanket.
Would
why
you like
don't
your
you?
robe?
Yes, please.
Okay.
Okay. I'll take her pulse.
Okay, I'll continue. Have you noticed any recent changes?
Well,
There you go.
now, oh, thank you.
She's gotten really pale.
Oh, really?
Yeah.
I used to be the color of my granddaughter over here, and now I am so pale I cannot stand it.
Oh.
Has anything else changed lately?
I am not hungry at all.
When has it started?
About
A
2
couple
weeks
weeks
ago.
Oh, okay, that's a big change.
I'm gonna take your blood really quick, so if you can just bear with me. I'm gonna squeeze it, clean it.
Okay, and if I can sneak over here.
Okay.
Oh, yeah.
Sorry.
Keep that for later.
Can I just look inside your mouth? My pen light? Okay.
My tongue feels so
Yeah, it's a
slippery.
little smooth.
It feels so smooth and slippery.
Yeah.
Okay.
Have you been eating a lot lately?
No, and she keeps bringing me enchilada.
Yeah. What is the medicine that's on the table there? Can I ask?
That is,
Just some stuff we've been using to try and make her feel better.
Oh, okay. Do you mind if I take a look?
Oh, of course.
Okay. Well.
we've been taking lots of aspirin.
Yeah.
Yeah.
Okay. Do you have any problems with bleeding, or do you have any heart problems currently?
Well, I just lay on this couch so I don't get up and I don't get cut, so I don't know.
Okay.
Have you noticed any bruising, especially if you hit your arm on something?
Oh yeah, a bruise the size of China on my back.
Oh, yeah, I see that.
Wow.
That's pretty
Okay. Well, we have what we need so far to call the doctor, so we're gonna call the doctor and see what we can do for you. Okay? We'll be back probably later this week. Okay?
Gracias, señoras.
Bye.
Thank you
Hope
guys.
feel better. Bye.
Ding ding. Hello.
Hi, this is Jenna. I'm with the Home Health Agency. Do you have the labs for Miss Rosa Luna?
Oh, yes, I do. Let me just look them up.
Okay, thank you.
Okay, so Ms. Rosa has a low platelet count. She has low white blood cell count, low reticulocyte counts, and she also has a low H&H.
Okay, anything else?
Nope, that
Okay.
is it.
All right, thanks.
Bye.
Bye.
Ring ring.
What?
Hi, my name is Erica. I'm with the home agency, the Visiting Nurses. We went to see
Okay.
Rosa Luna yesterday at her house, and she presented to us with dyspnea at rest. She has palpitations, tachycardia, glossitis, a smooth tongue. She also is very pale and fatigued. We had her labs drawn. She has a low platelet count, low reticulocyte count, thrombocytopenia, and she also works with pesticides at her job.
Okay.
We were wondering if we could get a medication ordered for an iron binding medication. And
Okay, she can have Desperal, and you can figure out the dose on your own. I think
Okay.
you can handle that.
Okay, and I also want to know about a maybe possibly a blood transfusion.
Yeah, whatever.
Increase
You do what you want.
blood
You can write the orders in too. I don't have time for that. I am a very, very busy person. I have a lunch meeting at 1. Do you need anything else?
Nope, I will call you when I get that figured out. Thank you.
Alright, bye.
Hi, Rosa.
Hi. We got the orders back from your doctor. I let him know what was going on. He wants you to start a new medicine. It's an iron binding agent. It will help you pick up the oxygen that you're missing because you have low red blood or you have low blood count. So your platelets are low. Your white blood cell count is low. Also, so we want to try to reduce the risk of infection.
So we want you to stay away from fresh fruits and vegetables, and as well as meat. So you wouldn't eat that salad there because there's a lot of bacteria in it, so you're at more risk to get an infection. Also, it would be good to stay away from large crowds with a lot of people because you could get an infection from that. You also want to make sure you wash your hands, and you make sure you wash your hands too, so you don't get sick.
Hey, you keep me safe, honey.
I will, baby. All right, and then you're also at increased risk for bleeding. So you said you were taking a lot of aspirin.
Yeah, I love aspirin.
Okay, well, I would prefer if you would just take Tylenol because aspirin can also actually cause ulcers in your stomach. And since you're at risk for bleeding, that could actually cause you to bleed out, so.
Oh, I never knew that.
Oh, yeah, so.
Along with that, we're gonna have to ask you to stop taking the other medications that weren't really for your particular problem because we don't wanna try to increase the risk you have for getting another type of problem, things like that. And then along with your diet, we're gonna have to ask that you stay away from dairy as well because it has a lot of bacteria in it. So anything cooked you can have, and anything that's not like a fruit or vegetable. So you can have like bread and things like that. Do you have any questions for us? No. Okay. Do you have any questions?
I don't. Thank you,
Alright.
guys.
Yep, thank you.
Alright, hope you feel better.
So after going over Miss Luna's charts, it looks like we have a nursing diagnosis of the risk for infection.
And I see that that is related to decreased resistance and increased susceptibility secondary to leukopenia.
Yeah, and all the other deficiencies in the blood that we found. Some interventions that we can give to her, are the hand washing, like we said, and the dietary.
Yep, and we can make sure that she's either wears a mask or avoids being around large crowds or very young children.
And maybe she should think about getting a new job and not working with all the environmental exposures that she was.
Yeah, and we can hook her up with some resources to help her with that too.
And have a nurse probably go there once every couple of days.
Yep, alright.
Awesome.
Okay, alright, I'll see you later.
Yep, bye.
Con los terroristas. And do the Harlem Shake.